Hi, welcome back to our channel. Today this is a video that was requested by a couple of people, which is about stem cell transplant and whether it helped with my stiff person syndrome. First of all, I would like to say that the stem cell transplant therapy is definitely like the last thing that you want to do for your stiff person syndrome, in a way that there's nothing else after that. So like there's currently yeah. And someone was also asking about experimental drugs, whether there are any experimental drugs.
Not whether there are any experimental drugs, whether there are any trials.
Let's address this question, whether there are any experimental trials. So stem cell transplant is an experimental trial.
Kind of. It's not an official trial in every place that it's taking place.
No, but it's experimental. So before that, you go through a standard procedure, which is benzos, like any benzos, then any other muscle relaxants. Then you can get IVIG, which is intravenous immunoglobulins.
Yes.
And there's a plasma exchange that for me went horribly wrong, and I wish I could share it, but Dion hasn't edited the video yet, even though we probably recorded it like a month ago. But I will at some point. And after plasma exchange, there is rituximab.
Possibly, it depends.
Well, I was rejected for rituximab, so...
Yeah. That was the route your neurologist took, but some people are offered rituximab, some people aren't.
Yeah. Apparently there's not enough evidence for stiff person syndrome that would work, so so I wasn't offered that. Probably that's a good thing, because then I was offered a stem cell transplant. There are other things like immunosuppressants that can help. I think beta blockers can help a little bit, but you have to, like, everything, pretty much everything that you get for stiff person syndrome is off-label, isn't it?
Kind of. I mean, muscle relaxants make sense because they're for relaxing your muscles.
Yeah, but hardly ever they say that this is...
But because stiff person syndrome is so rare, it's not really noted in the documentation for these medications.
All the options failed. I had to do stem cell transplant. I can't really tell you the full picture of it because it's been almost a year now, and you know, I had a major treatment then, major chemotherapy, and I haven't been under I haven't seen a specialist oncologist in that year at all.
You haven't seen a neurologist either?
No, but that's kind of I don't really want to be honest, but let's not go there. But I should be seen by the stem cell transplant team.
Possibly. Well, you should be seen by a neurologist. They should be running tests to see how effective the treatment was.
Yeah, I was gonna get to that at later point. But yeah, but I might be ridden with cancer at this point, not knowing without it, and so I'm not going to tell you like, yes, go for it. I mean, and when I said that it's a last step, also, like, you have to think about it, because my onset was so quick and I would be dead by now. And also I couldn't do anything. There are people who manage to live with this condition and they do it quite successfully. I mean, as successfully as you can live with disability. So honestly, I can't really say like, yeah, go for chemotherapy was great. Not so much, but in my case, yes, I can tell that it's why it saved my life. So there were a few complications after. Main one is thyroid. So when I got out of the hospital, my thyroid was overactive. It's something happening with my speech lately. I noticed.
You can't remember how to pronounce words.
Yeah, I can't pronounce. I haven't been able to pronounce words properly. Like even less properly than usual, like, so bear with me. So my thyroid was overactive, so I pushed for my oncologist to check it, because he was saying like my heartbeat 180 beats per minute is probably because I'm so out of shape. No, it wasn't. And then at some point, and I was put on beta blocker, so my heart would get some rest. But then at some point, my thyroid flipped, so it became underactive, which I kind of expected that was going to happen. I mean, I was told that was going to happen, but I wasn't told when. And when that happened, I just thought there was sometime after summer, and I just thought I was just tired because, you know, stem cell transplant, and I also got menopause, chemotherapy menopause, I'll get to that. But I thought I was just tired, but then it turned out that actually the symptoms I'm experiencing are caused by underactive thyroid.
I think part of the problem is it's not that they didn't tell you when to expect it, they didn't tell you what to expect if you had that. So you didn't know what you were feeling, whether it was related to something you were expecting or not.
Yeah, but there's another issue is that because I'm not being medicated, I'm feeling so much better. I'm being medicated for underactive thyroid, and also I've been weaning off beta blockers. So because I'm like weaning off all these pills that I was taking for stiff person syndrome, and then for things that came after stiff person syndrome, I didn't really know what was what, and I thought maybe I was just feeling tired as a result of something else. Like, I've got such hormonal imbalance, and because, as I said, also menopause that is still not resolved. I mean, menopause will never be resolved, but you know, my medications are just still not set in the correct level. So I didn't know where it was coming from. So yeah, these complications, when they all come at you, you just don't really know what is caused by original stiff person syndrome, what is caused by withdrawing from the pills, what is caused by thyroid, what is caused by menopause, and maybe there's something new coming in. I wouldn't even know, because, you know, if you are healthy, you wake up one day and you feel a little bit like worse, you think like, oh, there's something wrong with me. I wouldn't even know that. So it's just like as a default for so many years. So did it help? As I said, like for me, yes, because otherwise I would die. But there's no, as Dion mentioned, there's no scientific measure of it. I should probably have muscle contraction check. I know that my muscles are still not stable on the left side. My left side was affected predominantly. And I didn't have blood taken to check whether I still have antibodies. So scientifically, I don't know.
But you can tell physically how you're feeling in some way.
Yes, so I'll get to that. But I was also talking to my hematologist, and she was very helpful. She said that, you know, like with these things, it's like one step forward, 2 steps backwards, unfortunately. So that's and that somehow should start improving. So that's how I'm trying to live right now. So there are some things that I definitely see improvement on. First one, the very important one, I'm able to go to the dentist now. I mean, I actually finished all my appointments. My teeth were
You've got
fixed.
up with all your problems with your teeth.
I had problems with my teeth before.
Yeah, but it was quite some time before you had the stem cell transplant, and you knew you had problems, but you couldn't do anything about it.
I absolutely couldn't go to the dentist when I had a stiff person syndrome. That would be impossible for the dentist to actually come anywhere close to me with his tools and do anything to me. At the moment, yes, I can do it. I can even climb to the first floor with Dion's. There's that also receptionist who helped me, and the dentist then helps me to get on the chair because I struggle with that. But they know my issues. They are very helpful. So that's a good thing. Then I take less pills for stiff person syndrome. which I could tell you is a relief for my liver, probably, if it wasn't for the fact that I put so much toxin through my liver by having chemotherapy. So overall, I'm not entirely sure that was a positive. There's a positive thing for my liver, but I don't have to rely on things like tizanidine, which is a very powerful muscle relaxant that I was taking every day, and it was making me quite drowsy during the day, and I couldn't sleep during the night. So I'm off it. I don't have to take opioids. Sometimes I take them, but I don't take them every day. I used to take them every day for years. And because of that, I also had problems with basically pretty much lots of things, like regulating my bowel movements. Like, you know, like, can imagine like taking opioids every day. And sometimes I had to use enema for help. And when I was stuck in the hospital during plasma exchange, that went horribly wrong. I really wanted to do enema to help myself and to help my body. And then the doctor came over and she was like, enema, is that a Polish thing? Were you there when she asked me?
I don't remember.
It's the one, she was the
I know which
female one.
I know which doctor you're talking about, but I don't know if I was there when she asked that question.
I don't have to deal with these questions anymore. That's good. And another one on my list is no more hospital stays. So I still have to go to hospitals for some, because as I said, I've got still complications, but I don't have to stay there overnight, which is a relief. Sometimes I'm able to walk with using my walker, but that's not too far. I can't go outside on my own. I get extremely, I don't know.
You get overwhelmed by it.
Overwhelmed, yeah, I think that's a good word to use. Yeah, extremely disorientated. I don't really know what's going on around me. And also, you know, the thing that comes with stiff person syndrome when you're not able to cross the street. I actually went with Dion across the street. Was it last week that we went?
Yeah. Last Sunday.
Last Sunday we went over to our neighbors just to ask them something. And it was across the street, and I used my walker and I had Dion. I was aware I was on the street, but I was able to just cross it. Back in the days, I would just, Dion would have to wheel me there in a wheelchair in the first place. But if I wasn't in a wheelchair, I would just get stuck. My body wouldn't care that I'm in the middle of the street. I would just get stuck, and Dion probably would have to carry me. Isn't that true? Mm-hmm. Yeah. So this time I just crossed the street. So that's an improvement. It may seem trivial to some, but it's a small step. And also, it's just the fact that I'm actually making some progress, even as small as crossing a street with help, but still doing it. It's bringing me joy, because what I could witness before having stem cell transplant was just progress, but in SBS. So every day was worse.
Negatively progressing.
I mean, negatively progressing. Yeah, definitely. My disorder was progressing while I wasn't progressing. I mean, I wasn't getting better, and I knew that I wasn't gonna get better, and that was heartbreaking. No matter how much I was trying, it was getting even worse. So there are definitely really good things. There's a great area. I am alive, but that is a questionable thing in a way, because previously I knew that I was slowly dying, but at least I knew which direction I was heading. Now I'm alive, and I don't know whether I'm gonna relapse or whether I'm going to carry on getting better. I would really love to, at this point, get PET, but I'm thinking, is there a point? Am I gonna live long enough? Am I gonna live? What did I do to myself? And I just don't know whether I should be happy or not. I just don't know. It's I guess it's like having a cancer and then being happy that you are cancer free, but every time you check whether you're cancer free, you are worried that this cancer may return. In a way, it's a relief, because it's a final stop, so I know that if it comes back and I am relapsing, then that's it. I'm not going to be trying anything else. I know where I'm heading, and I guess there's nothing else.
No. There's nothing else you could try at this point.
And I won't be waiting for another point. And everyone around me understands that.
But by that point, something else might be available.
Stop. I already spoke to my mom. She said, like, this time everyone is going to honor. I don't know. She was speaking to herself that they're going to honor my wishes. So withdrawal from medication that I'm reducing. The fact that I was able to reduce them is a good thing. Withdrawing from them is like, I'm not feeling well, and then they're adding to all the symptoms, and I don't really know what's going on thanks to that. I still have a startle reflex, so if you watch my first video about how the symptoms of SPS, the startle reflex is still there, and it was very debilitating. I'm still scared of certain things. I'm still scared of moving around, to be honest. But this time, I feel differently. My body is scared of moving around. My body is telling me no. My body is stiffening up. But my mind is not actually exercising it. It's not appeasing my body. So my mind is like, ha ha ha, you can do it. Just try it. So I'm like being more open to move around. Yeah, I still have spasms.
Occasionally.
Yeah, but I don't have seizures. Like, I'm not suffocating anymore. So I will feel very, very stiff, so stiff that it will be hard for me to get out of bed. But I won't feel like I can't breathe anymore. It's a relief. I don't have a control over my hand, like I can see right now. I'm not doing that with my fingers. They are doing that on their own. The two, yep. So it's a struggle to type on the keyboard and use them to make up or anything. Anything like that. I can feel my foot is just playing up a little bit. However, I feel like this thing's maybe gonna get better over time, because very often I was waking up with fisting. My fist.
Don't say fisting.
So I was waking up with my fist clenching, properly clenching. Now I don't do that. It's just only if I do activity with my left hand. It's not cooperating the way it should. Also, I can smile pretty much, but then if I try to apply lipstick to my mouth, you can see that this is still slightly moving. So I've got twitches. I've got lots of twitches. I've got my twitches in my eyes, twitches in my feet. My is mostly left side, twitches around my mouth, and as I said, my hand is not cooperating, which is really weird. I've got classic stiff person syndrome, which means that it shouldn't actually.
It doesn't mean that it doesn't affect anything else. It just means it primarily affects your trunk area.
Yeah, it always affected my left hand and my two fingers. And I don't know why, but this is still happening. And every time this happens, obviously, I really, really worry. It's like having new immune system. It's like having a new baby. I never had a baby, so I don't know. But it's like always looking like, oh, what is it doing now? And what is it doing now? And is it good? Is it bad? Is it going to get better? Is it going to get worse? It's a struggle. It's a little bit of a struggle to, as I said, like this cancer comparison. It's just like you always watch yourself and you think, oh my god, it's back, and never actually went away, but now it's even more back. So the main things, I think overall I'm feeling more positive, because I'm starting to think that things are going to get better.
I think it's still unclear because you're still reducing medications, and that is causing some stiff person syndrome like symptoms. So it's
yes, but you have to understand I was on 60 milligrams of Valium, and when I say that to people, they think that I meant 60, 60, which is a lot. Like that would probably knock you out, wouldn't it?
Oh, definitely.
Yeah.
10 milligrams would probably knock me out.
Yeah. I'm on 25 now, which is actually massive drop. And so I'm having all the symptoms while being on less medication, which is good. So what are the main takes? As I said, it's a process. So if you are managing your stiff person syndrome, then that's probably not for you. If you're feeling that you don't manage, I
think if you don't manage and you've tried IVIG or plasmapheresis, plasma exchange,
and any other things that your doctor can come up with, because
yeah, if you've tried these things and they're not improving your situation, then maybe it's time to think about having a stem cell transplant.
Yeah. And the lessons that we learn is like, when it comes to stem cell transplant, we're saying it's experimental therapy, but I had to pay for it, and lots of people with stiff person syndrome have to pay for it in the UK. Actually, I don't know about any instance when people didn't have to pay for it. And as I said, in my case, it was £40,000. I know that in another city here in Sheffield is £65,000. That's a lot of money. And when I say it's a missed opportunity, I'm saying that from what I can say, it could be a potential. Definitely stem cell transplant as a therapy is a is a potential. So I wish NHS could actually see these little things that, they've got people that they can experiment on, let's put it this way, because I was eager, but they are not willing to, to foot the bill, even though they were willing to foot the bill for IVIG for me, which was ironically more expensive than stem cell transplant. Over time, yeah. But it wasn't really helping. So I don't quite understand that. That's the missed opportunity. And also I noticed that I missed opportunity when back in 2018 it was, or maybe was it 2018, I don't remember. Anyway, after I was diagnosed, I was referred to neurophysiotherapists. But I had the idea, I already, when I diagnosed myself, I researched the thing. I knew that stem cell transplant exists because I knew about cases in Canada, and I was already pushing towards straight from the first appointment, to be honest. And then I went to neurophysiotherapy, and I was told that there are patients who go to India for MS, and I was told that this is a really stupid idea to actually do that, because India does it wrong, because they keep their patients 6 weeks on the bed rest after the stem cell transplant, and that would never happen in England. Listen, that is such a silly thing to say, because after stem cell transplant, after just laying in a hospital for 3 weeks and pretty much just having like I had central line, I've got my central, I've got scars here, so it was going here. So I was connected to IV machine all the time. So I was just laying in bed, I couldn't move. So guess what happened to me after coming out of the hospital? I couldn't move at all. I had to stay in bed because I couldn't even stay in the same room as Leon. I was in this room, which we called our recovery room, and everything had to be specially prepared for me. The water had to be, even though it got filter and the water is safe here to drink from the tap, we still had to boil it. So he had to boil it. I couldn't even move out of bed. I could barely get to the toilet, and then it turned out that this thyroid was preventing me from doing lots of things because I was getting so tired. No wonder, because my heart was beating so fast. So I wouldn't have gone to India at that point. I would have gone in 2018, because now I'm thinking about it, it's not so much about the money that I'm so salty, it's the fact that I missed so many things, because it's 2023, I'm still having lots of issues. I think I was robbed from that time, because I wasn't even able to sit like this and record video. That's impossible for me. That's the thing that I would have done differently. I would have just done it I would have gone to India. Also, the good thing now is that because I'm not taking opioids every day, and I've got stiff back or any sort of pain, I had a root canal done. Now when I take opioids, I can really feel it, you know, I can get high like that. I didn't know that before because I want so many
You did know
drugs.
it when you first started taking them, but...
Yeah, but I forgot, I completely forgot. I still don't like the feelings of that. I wouldn't actually do that as a recreational drug. That's absolutely, I don't actually condone it on this channel. But what I'm saying is like, now I can see what people mean by saying that, you know, that you can get addicted to it, like not just dependent, be physically dependent on it, but also, yeah, I kind of see it. I still don't like the feelings, so I probably wouldn't, but yeah, I understand that. So to anyone who's in America, your healthcare system is your curse, but it's also your blessing, because if you can't afford it, then that's a shame. But if you got like weird condition like this one, you can become experimental subject for free, I guess. So unless I'm being really ignorant, please correct me in the comments. I would really appreciate that. I'm planning to do more regular updates. I'm hoping to feel better now that so that's pretty much it for SPS update. You're gonna get plasma exchange video at some point. No one asked for it, but that's okay. Maybe you'll find something useful there. And thank you for watching. Share this video if you feel like it. Give us a thumbs up, yeah, whichever way you feel about it. And also please consider subscribing. That's it. Bye.
Thanks. Bye.